As an opening remark, I'd like to welcome all of you to this meeting. That we will have a presentation from Serchi on the Solidarity Fund for Malaysia, which is one of the worst hit countries from a statistical perspective. Now, I must say that it is really wonderful to see Malaysians from the various religious communities, the Buddhist, the Christians, the Muslim religious communities, and eventually I think we will also like to reach out to the representatives from the Hindu, from the Sikh, as well as from the Taoist community. At least we have the major religions here represented for this meeting, in order to find out how does religious NGOs help out in the current COVID situation that the country is in right now. Now, I must also mention that on Monday, the 7th of June, that is at the start of this week, we have met up with various Buddhist leaders from the Theravada Buddhist community, where a presentation was made to rally support from the Buddhist community. And Brother Peg, who was representing the Vajrayana Buddhist Council Malaysia, had asked that this same presentation be given to the leaders of the Vajrayana societies. In the Monday meeting, it was also expressed that we can get other religious groups involved in the Solidarity Fund. It would be an excellent showcase of Malaysians coming together to work towards a common goal, that is of helping out Malaysians. And this is indeed the true spirit of Malaysia, the country where we belong, and caring for our fellow Malaysians in a heartfelt solidarity. Now, represented tonight, Chief Reverend from the Buddhist Mahavihara, leaders from the Vajrayana Buddhist tradition, and we have our Muslim brothers from ACCIN and ABIM, as represented by their presidents, Tuan Haji Muhammad Jamaluddin and Encik Muhammad Faisal. And we also have with us the Archbishop, Reverend Julian Liao Beng Kim, and of course, he is both the Archbishop as well as the President of the Interreligious Council in Malaysia. And Reverend Archbishop Julian will join this meeting in order to get a better understanding of this initiative, so that he might be able to explain this initiative to his EXCO members, that is representatives from the Buddhist, Christian, Hindu, Sikh, and the Taoist community. Now, as a background, maybe it might be useful for me to give a sequel to this Solidarity Fund that we'll be talking about tonight. Now, when the pandemic of crisis proportion broke out in Nepal and India, and this has grabbed the global headlines in late April this year, IBC Malaysia had a discussion with IBC World, that is based in Delhi in India, as to how we can help to supply the medical equipment. As you could see, as you read the newspaper, you could see that because of the shortage of oxygen concentrators, the N95 masks, PPE, gloves, and all that, the situation in India was actually really, really bad, right? So because of that, the IBC Malaysia wanted to do something for India and for Nepal. So IBC Malaysia reached out to Serchi to explore how can we contribute and collaborate to help India and Nepal. So through an online meeting that we have with Buddhist societies and Serchi, a quick fundraising campaign was launched in May, and that was last month. So it was only a three-week of fundraising effort, and it actually yielded very good results. Thanks to the contribution of Serchi and the Buddhist Network, we were able to procure 950 oxygen concentrators, 2,000 units of oxygen cylinders, 1.5 million gloves from Top Gloves, 58,300 pieces of N95 mask, 2,000 sets of PPE kits, both for India and Nepal. And these are the items that are so badly needed there. So we met in May, at the start of May, and towards the end of May, these items were already on their way to be sent over to India and Nepal. So this was an excellent work of collaboration between Serchi and the Buddhist Network. But even as we were giving aid to India and Nepal, at the back of our mind, we were anticipating that the COVID situation in Malaysia would actually worsen. I think all of you know why, right? Everybody was talking about it. It is because I think people are a bit tired of social distancing and following the SOP guidelines, which we had for about a year. And so our worries, as far as our worries are concerned, this has now come to pass. And this time around, it is Malaysia that needs help. Just 1 month later after India and Nepal. Now, let me just talk about the severity of the situation. We are now hit by a sharp spike of COVID-19 cases that have overwhelmed our hospitals and the frontline health workers. The COVID cases in Malaysia have risen to 640,000, with 5,000 to 6,000 new cases daily. This is something that we cannot actually imagine. And over 3,600 Malaysians have lost their lives from COVID. And as a result of which, the public healthcare system is struggling to handle the rise in this critical COVID-19 cases. Now, the Director General of the Health Department has actually admitted that the hospitals that have allocated beds for at the ICU and the critical treatment centers in order to treat COVID-19 cases have hit the alert threshold. In fact, some of them are actually full capacity. There's just 100% of the beds, of the ICU beds are taken up. And the latest figures I saw, it's gone up to 105%. I do not know, they managed to squeeze in another 5% of beds. And because the category 4 and 5 cases requiring critical care beds continue to surge. Now, under such circumstances, the doctors will have to prioritize the allocation of ICU beds, which are to be given to patients with high recovery potential. That means patients with a chance of recovery will get the ICU beds. And the patients with low recovery potential, that is those people who are really in a bad shape, right? They will be shifted to the normal wards to make way for other patients. And this means that their chances of recovery is even much less. And there are some anecdotal cases of patients who have been sent home because the hospitals cannot accommodate them. And in other words, the doctors face a gruesome task of deciding whom to save and whom to be left to their fate. Now, as the situation became dire, some public hospitals and government clinics have appealed to SACCI to help out. And we know that SACCI have always been doing this throughout the world. It's international organization carrying acts of compassion for everyone, regardless of race, religion. You know, as long as disaster strikes, SACCI will be there to give a helping hand. So our hospitals have reached out to SACCI, and SACCI has in fact been in close contact with the hospitals and clinics and have taken into account of the equipment that they require. In other words, the equipment they're short in. Since May, that is last month, SACCI has committed to donating more than 6.2 million ringgit worth of medical and related equipment to several hospitals. But they estimate that we actually need 10 million ringgit worth in order to supply life-saving medical equipment to our hospitals. So this is the target. From 6.2 million, we need to move up to 10 million, right? Now, after the successful collaboration in the aid to India and Nepal last month, SACCI has proposed the Solidarity Fund that would involve the participation of religious NGOs. So in this regard, a presentation was made to NGOs from various religious groups to see whether or not we can join forces in order to raise funds for this Solidarity Fund. So firstly, it began with a Buddhist community, but in the last meeting that we had, the idea is, why don't we open up so that the other religious groups in this country can also join hands? Because this is a work that we can do for our fellow Malaysians, yeah, for the country that we come from. Now, as we know, the patients who are hit with COVID-19 are Malaysians. And the virus does not discriminate against people by race or by religion. We ourselves may have family members or relatives or friends who have contracted COVID. Many have recovered, but some could have unfortunately lost their lives to the virus. So this is indeed a very good opportunity for Malaysians of all races and of all religious groups to collaborate in a fundraising drive. This is to show our solidarity as Malaysians working together as an act of great compassion during the time of crisis. Now, how can we help? Coordination in this effort is really important. When we concentrate our efforts and pull our resources together, the impact of our efforts will be increased. And this also means that we will reduce overlapping donations of equipment that come from multiple donors. Sometimes when people give you equipment and all that, sometimes it cannot actually be used. You have seen the video that in Florida, they have to throw the ventilators from China, all in boxes, because it didn't fit the specification. So really the equipment that is used by the hospitals can vary in model as well as specifications. So actually donations should preferably be in the monetary form, because then it gives the flexibility to buy the right equipment that is actually needed by the hospital. And I must say that time is not on our side, because the hospital beds and the medical equipment are urgently needed. And the target of raising 10 million ringgit is set for the month of June, the month that we're in right now. So we need to act fast. So tonight, what we will do is we will get a briefing from Serchi Kuala Lumpur Selangor on this matter. And then we can decide if our organizations can be part of the Solidarity Fund initiative. And obviously, at the end of it, participation agencies will be credited. We could maybe organize some kind of a press conference in order to recognize contributions. And this will be a wonderful thing for Malaysians to do. The religious NGOs of different religions getting together to do something for Malaysia, right? And we can help in raising funds, or we can even link up to corporations that might wish to make contributions as part of their CSR commitment. And all the donations towards the Solidarity Fund, because it is channeled to Serchi, will be entitled for tax exemption. So that is my opening statement and giving the context of the whole issue. So now let us move on to the next part of our agenda, and that is getting a briefing from Serchi about the Solidarity Fund. Can I invite Brother Siam?
Yeah, thank you for your kind introduction for Datuk Sri Victor Wee. Salam bahagia pada Tuan Haji Muhammad Jamaluddin, Chief Reverend K. Sri Dhammaratana, Reverend Julian Liao, and many other leaders of NGO and from other faith organizations as well. Sorry if I miss out any of your name. I think we are very glad that Chichi given an opportunity to share with you a very important project for all of us. I think it is known that our hospital are at a critical stage. So I think we as a Malaysian have to work hand in hand to overcome this crisis together, because out of every 100 Malaysians, 2 of them are now infected by COVID. So I'm sure most of us have family members and close friends, more than 100. Many of us are affected. So it is high time that we need to work together. And that's the reason why we need to set up this Solidarity Fund. And I think that what the DG, Dr. Noor Hisham, had mentioned, the hospital capacity have reached a critical alarming stage at 104%. It practically means that we have to start denying the services to some of these patients who need the services. So I think it is a dilemma for many doctors who to save. And I think it is very disheartening to see some of this development. And what can we do as a humanitarian organization? I think when Chichi has been in constant communication with most of these hospitals ever since the pandemic happened, while we receive a lot of calls and talking to different pengarah from different COVID hospitals here in Malaysia, we realize that Malaysia are indeed in a very dire state where a lot of these medical equipment are needed. So between 24th May to 8 June 2021, over this short period of time, we have already donated to several COVID hospital here in Malaysia, which is amounted, like Datuk Sri Victor said, it is close to about 6.2 million, just over a 2 to 3 weeks period. So you can imagine how acute the situation is. And most of the equipment needed are practically used for ICU purposes, like for instance, the ventilator, the ICU beds and the medical beds, So these are the items that are critical in need of help. So let's watch a short news about what we have done over this period of time.
In Malaysia, Tzuchi's footsteps to bring assistance and care never stop. Facing the third wave of COVID-19, Tzuchi Kuala Lumpur Selangor chapter has helped hospitals in need. They donated medical supplies to local hospitals. The medical professionals have expressed their gratitude for Tzuchi's donations. Let's take a look at how Tzuchi volunteers reach out to different hospitals. Facing the pandemic, Malaysia's medical team is up against more challenges. At Tzuchi Selangor and Kuala Lumpur chapter initiated its third wave of aid. Within a few days, volunteers prepared supplies and arranged a distribution at the hospital.
Based on humanitarian values, Tzuchi immediately contacted local vendors. In order to save lives, we discussed with different teams, and after reaching consensus, we purchased supplies for the hospital.
I mean, this is really a contribution that really will help us. With this, we will get better and more assistance for our staff. I must say, I'm very thankful to Tzuchi, all members in Tzuchi for coming together to help us, in these trying times.
Okay. Let me see. How come it drops?
Under the pandemic, let us hope that gathering in Malaysia.
Okay. So, well, apart from the recent spike of the cases where Tzuchi had delivered or donated a lot of medical equipment, when the pandemic started, actually, Tzuchi has started our response effort since January last year. So we have divided our response effort into 3 phases. During the first phase, when this pandemic happened, in January, we began to supply a lot of this PPE to all the hospital and to the frontliner. And during the second stage, when MCO was implemented, a lot of these vulnerable groups, such as the refugees, foreign workers, and the B40 are badly affected. And that's where we started to provide food relief to the affected families. And at the same time, when MCO was extended over several months, more of the Malaysians are affected as well. Many of them lost their job. And this is where we begin to provide cash aid to all these families. And during this current phase where we have started to distribute some of this medical equipment to the hospital. So over the period of during the MCO, thanks to the kind donation from different companies, corporate individual, such as Top Glove, for instance, is one of our volunteers. They have given full support to us, not just to Malaysia but to overseas as well. So we have donated more than 1 million, and plus many other PPEs as well. And we were very glad that government has given us the right to move around to distribute some of this PPE to more than 2,000 institutions here in Malaysia, in particular to the hospital all over Malaysia, clinic kesihatan and private clinic as well. And not to forget some of these government institutions such as the police and the jail. Okay, and like I mentioned earlier, most of the Malaysians are affected as well, and that's where we have initiated a project called Kita Satu Keluarga, which is meant for the underprivileged family, not B40 but B20 per se, whose household income are badly affected by this pandemic. So we have given out a cash aid of 300 ringgit to 800 ringgit per month per family, depending on the predicament of their family. And we have done it over a 3-month period to help sustain their basic living needs. And we were glad that we received overwhelming response from different races, Chinese, India, and Malay as well. Just over a 2 weeks period, we received more than 4,300 over application. And we do house visit we mobilize our volunteers to do house visit to every family. We want to make sure that only the real ones are being given the cash aid. So it has actually benefited more than 2,000 families over a 3-month period. So in total, we have spent over 3.8 million. Okay? And let me show you over this short period of time what Tzu Chi has done through a video.
A second wave of coronavirus infections this winter likely will be worse.
January 2020, the COVID-19 pandemic spreads rapidly on a global scale.
Utamanya ialah larangan menyuruh pergerakan dan perhimpunan ramai di seluruh negara.
There were 5 evacuations in less than 5 months. Tzu Chi swiftly mobilized manpower to distribute daily supplies to the evacuees under quarantine, giving them peace of mind. The severe pandemic posed a public health crisis. Tzu Chi KL and Selangor proactively backed the government and medical personnel. Faced with the invisible virus, a professional team is essential to support the frontliners.
管制一颁发出来的时候呢，其实很多人都还没有完全准备好。那时候我们就成立一个 Covid-19 的后勤小组，里面除了有医疗团队之外，我们也有企业家、职工。那时候初步我们制定的方向是，第一，我们要补足政府医疗上的不足；第二，安定人心。
Since the MCO started on March 18, Tzu Chi volunteers began to make face shields, clean up hospital wards, and produce isolation gowns. As at June 3rd, Tzu Chi had supported 142 hospitals and 1,404 clinics. The frontline workers are among Tzu Chi's top priority, while protective equipments are crucial to support the medical system.
Kekurangan PPE di Kementerian Kesihatan dan juga di klinik swasta, lebih-lebih klinik swasta PPE ini untuk kegunaan di klinik kami. Walaupun kami boleh beli, tapi masalahnya produk tak ada di pasaran. Terpaksa menunggu import dari luar negara yang mungkin agak mahal.
要把这份爱送去前线，外面还有这一群人在关心关怀他们。
During the MCO, the homeless had nowhere to go. The City Hall Enforcement Unit gathered this group of vulnerable people and gave them shelter to prevent infection.
Barang-barang keperluan homeless macam sabun mandi, sama ada buku ataupun ubat gigi, sabun basuh baju yang.
Tzu Chi delivered daily supplies and multi-purpose foldable beds to the homeless shelter. To support the police and military personnel in their MCO operations, Tzu Chi sent face shields, masks, sanitizers, and other protective equipments to police stations and army camps.
Dalam tempoh PKP ini tidak beroperasi.
With a significant increase in the number of inmates, Tzu Chi donated 5,000 mattresses and 10,000 masks to the prison guards and inmates. As society came to a standstill, vulnerable groups lost their incomes. Tzu Chi delivered timely aid to needy families, refugees, foreign workers, and stateless people.
Kerja gaji, kerja tak gaji. Saya selama ada corona, saya pinjam duit, tak ada bagi.
Working with UNHCR, Tzu Chi provided cash aid to refugees across Malaysia. Tzu Chi also started hotlines, while volunteers paid visits to needy families, not leaving out anyone in need.
一些米啊，一些米粉啊。
mask mesti 他们其实从他的那个港风区去那边哦，主要通道都会有警察在检查嘛。那他们这一群都是没有任何的证件嘛，所以他们都不敢出去，所以他们只能仅有的剩下的米呀，他们捕鱼啊来吃啊。
From Klang Valley to the stateless communities in East Malaysia, Tzu Chi distributed daily necessities and shopping vouchers to alleviate their suffering and warm their hearts. Wherever there's a need, Tzu Chi will be there.
就口罩还有呼吸器各方面各种防疫物资非常的短缺。
Within 35 days, Tzu Chi KL and Selangor completed 50,000 isolation gowns, 20,000 boot covers, and 30,000 head covers, and delivered them to the worst-hit country, United States.
作为社会的观察者，时常看到需要帮忙的地方有慈济的影子在，慈济站在最前线，无形中也带动了更多人做同样的这个事情，促进这个社会的和谐跟爱心。
Sungguh bersyukur dan amat gembira sekali kerana ada rakyat masih prihatin kepada pasukan polis.
So I'm glad that Tzu Chi came, approached me, because we have to help them, irrespective whether they are citizens or not.
Semua terima kasih saya. Saya makan dengan cuma bagi saya. Thank you very much.
Sekarang saya sudah tak ada kerja, makan pun susah. Lepas itu saya punya sewan, bayar macam mana, duduk macam mana pun saya tak boleh fikir. So hari ini macam satu kali kasih saya. Thank you lah, thank you.
Terima kasih banyak-banyak. Mudah-mudahan itu Allah cipta dunia kasih ini NGO terbaik di Malaysia. Ya, terima kasih to NGO.
Yeah, thank you for watching. Well, whenever there's a need, we will be there to help. We have been inspired by our master, our founder, Master Chen, who have constantly reminding us whenever there's a need, we will be there wherever possible to help as many people as possible. And I think I'm very glad and touched that we have leaders from different faith and religion. Today, we would like to explore more on the Malaysian Solidarity Fund and how and why we should pull our strength together to overcome this pandemic. I shall hand over this to my fellow colleague, Sister Kaping. Over to you, Sister Kaping.
Thank you, Brother Sio. Good evening, Tuan Haji Jamal, Venerable Reverend Ratana. How are you? Good to see you tonight. The many elders and also leaders from the different NGO. It's quite an unprecedented occasion tonight to have so many of you coming together to want to listen to what we have to present. The key points that I will go through with you tonight are the challenges that is currently faced by our hospitals and our healthcare personnel, how we should actually pull all our resources together and strategize forward as one nation to tackle the big problem. As you've heard from Professor Victor this evening, that yes, our hospitals are in dire needs of help. Tzu Chi has actually, over the last 1 year, supplied various protective gears to 142 hospitals across Malaysia. And therefore, we have been in constant communication with all these hospitals, especially the COVID-focused hospitals. In fact, our team is in constant contact with these focused hospitals, focused hospitals, almost on a daily basis. What is worse today is that we have some very deadly new variants. And as a result of that, the mortality rate is very, very high. And hence, our ICU units across Malaysian hospitals are really strained, and they are incapacitated by insufficient funding. Now, no one has anticipated this pandemic. So as a result, there is insufficient budget for an emergency like this. And as we know, there are a lot of red tapes in the government, and hence funds cannot reach these hospitals in time. As I've said to many of my fellow friends, that we can sit around and debate as to whose responsibility is this, but many of us rather take positive actions and be proactive in going out to save lives. Many of those ICU people are in a life and death situation. So we cannot waste time, and we are in a very critical stage right now. So hospitals are making SOS calls, not only to Tzu Chi, we know that they are also calling other NGOs as well as corporates. So what is happening now is that we have some uncoordinated response, which is resulting in overlap donations of certain equipment, while some acute equipments, that those which are much more expensive, remain undersupplied. And also we have situations, maybe certain hospitals are overserved, whereas some are underserved. So there is also a panic purchase of equipments. There are not that many suppliers of acute medical equipment in this country. So when they receive calls from so many inquiries, automatically that push up prices. So it's not the best thing for us. Next, please. So what we are trying to do is to get people to pool all our resources together. Tzu Chi has the resources and the experience to actually pull all the data together from various hospitals and assess their needs, so that we will know exactly what is needed and where. We can therefore be very effective and efficient in responding to their needs without having, any duplication in supplies by multiple donors. In this way, we are also freeing the hospital staff from fundraising, from calling and dealing with multiple donors, as well as supplier of equipment. They shouldn't be doing this. They should be saving lives in the hospital. So we are very happy to take over that part of the job from them. And secondly, because of our diverse experience in disaster relief effort, we know who are the suppliers, and we are also getting the list from the hospitals. So in a way, we can therefore negotiate with the equipment suppliers for bulk discounts. And by avoiding to compete with each other, we do not have to pay up those prices. And also by doing this, we can ensure timely and coordinated delivery with the equipment suppliers. And many of you may not realize that Tzu Chi actually have our own panel of doctors under Tzu Chi International Medical Association. So our doctors will actually first vet through the list of what they require and decide what is actually necessary in this current moment of time. So that is due diligence that is being done by our own panel doctors. And we can also ensure efficient logistic arrangement with suppliers across Malaysia, as well as from other countries. In cases there are some equipments that may not be available here, we could get our contacts in Taiwan or even Indonesia, Singapore, to make inquiries, and therefore we are able to source from outside of Malaysia. As you could see in the video just now, we do not just leave it to the suppliers to deliver the equipment to the hospital. Tzu Chi volunteers will always be there to hand over those equipments personally. And we actually remove a lot of those items out of the box, especially like beds. So that could also save the hospital personnel from doing a lot of this work and having to discard those boxes later on. So what we can do is actually leverage on Tzu Chi's wide network. It's a global network for procurement and sourcing of this equipment at much reasonable prices and in the shortest possible time. Next, please. So what we are proposing is this Tzu Chi COVID-19 Malaysia Solidarity Fund, which is an emergency fund in response to the SOS calls from hospitals to supply acute medical life-saving equipment like ventilators, the high-flow nasal cannula, ICU beds, etc. And we are extremely transparent in terms of what we purchase and supply, and you can get this list from our website, which is updated regularly, if not on twice weekly, it is at least on a weekly basis. And what we really want is to form a formidable force to lead by examples, to inspire compassion, unity, and harmony. That is really demonstrating great love, that is the same values across all religion, all faith. So these are some examples of the key medical equipments that have been requested by all hospitals. Top of the list is, of course, the ICU ventilators. These items could range anything between 100 to 140,000 per unit, depending on the brand that is selected by the hospital. All hospitals have got different needs of different brands. And as Brother Victor said earlier this evening, that you cannot give a different brand that they are using currently because the accessories do not fit. So you have got to buy the specific brand, and more often than not, you have got to go back to the specific supplier. And that makes coordination much more difficult, but we have done that. And the most expensive item here is actually the central monitoring system, which costs about 230,000 to 250,000 per unit. And these are important in, in the ICU department in monitoring the performance of the patients. And what is also very needed in this current moment is the high-flow nasal cannulas. And these are expensive. It costs anything between 30 to 35,000, again, depends on the brands. And even when you think that more generic items like the ICU bed, they are expensive too. They cost anything, in the range, ballpark of 25,000 each. And many of these items come with different accessories, and they are add-ons, and some hospital wants it, some don't want it. So there is a lot of coordination effort. And for corporates that we reach out to, we tell them that, look, if you have not done this before, you are going to tie up a lot of resources in sourcing, in making inquiries. So why not, let us pool our resources together and do it. And we're willing, we have the resources to do this. So just to give you some examples of the hospitals that we have delivered these equipments to, these are Sungai Buloh. This is the stage 4 and 5 COVID patients center. And these are some of the beds that we have delivered. And today, in fact, we have delivered another 4 units of ventilators. And then, of course, there is University Malaya Hospital, and then the General Hospital in KL, and Ampang Hospital, Cheras Rehabilitation Hospital. Even though now we have committed up to 6.6 million, we are actually anticipating more COVID-19 focused hospitals to come forward. We are already, getting a lot of inquiries, and it is not just in the Klang Valley. We have inquiries coming in asking for help from Malacca, from East Malaysia, Miri. So it is actually across the country. So I think it will be a really great gesture if we can all stand together as one nation to solve this crisis together. That's my presentation for tonight. Thank you for listening.
All right, so thank you very much, Brother Siu Ki Hong and Sister Koh Peng, for your presentation. I think it becomes quite very clear. Firstly, we have seen the work that has been done by Churchy, and also to really understand that it is not, when you want to provide support and aid, it is not something that is just so easy, because in a sense, Churchy has also been in very close contact with the hospitals and really quite understand what are the things that they really require, so that we don't actually waste resources. I think the reason why we are calling the meeting tonight is to get a better understanding of what is required right now. So Churchy has made a presentation that this is not something that has come out of the blues. They have actually been supporting and be in close contact with the hospitals, with the clinics, as well as even the people, like the migrant workers and all that. But I think tonight what we would like to do is to focus on this fundraising solidarity fund. And maybe Kaping or Seo, do you like to say something about this fund? And how can people participate in this fund?
Yeah, sure, Prof. We have already started the ball rolling, because there was no time to waste when the hospital started calling us, with the head of the hospital calling us late at night saying that I need this equipment. I'm afraid that tomorrow I may have got to reject, the stage 4 and 5 patient. It really breaks our heart, even though we didn't anticipate it comes so fast right after Nepal and India, but we committed. We said yes. When there is a need, we have got to be there. So we have committed, and now we have launched, and with volunteers started the ball rolling in chipping in the money. So we have started paying for the equipment. But the equipment suppliers are such that, if you want it, you have got to place a deposit. If you don't place a deposit, you will lose your order. So for some equipments, we have already placed the deposit, waiting for them to come in gradually. Yeah, it takes sometimes a week, sometimes 2 weeks, and some may even take 3 weeks to come in. So we are in this midst of fundraising, and what we would really like you to do is that if you can actually reach out to all your members, make them aware that there is this fund currently in running for a very short period of time, because it's an emergency aid, and they can just bank indirectly to our account. And those who want a tax-exempt receipt, all that they need to do is give us their full name, their IC number, their address, and these are requirements by the IRB for the issuance of receipt. And if you need our help to draft any notices to your members, we'll be more than happy to do that for you, detailing what is this fund about. So it's really an emergency aid. And that's what we really hope that you can do to reach out to your members.
Okay, thank you, Sister Copping.
Thank you.
Now, maybe I can have by show of hands, if you like to ask a question, can you put up your hand? You click at, is it reactions? Where you can just put up your hand. Says, so there is a, if you put on the reactions, there will be raise your hands. You just put that, raise your hand, so then I'll come to you so that you can ask your questions. All right, maybe we just open the floor up to questions for you to really understand what is, how can you, participate in this Solidarity Fund.
Dr. Sri?
Yes. Okay.
Would you mind maybe get some actually comment from maybe Haji Jamal,
right,
and Venerable Ratana before we open up with the question?
Okay, maybe this is a good idea. Thank you, Brother Selki. So, well, we have the Archbishop here. We have Tuan Haji Jamal here, and we have Chief Reverend. Maybe who should start? Who would like to start first to say something? Maybe the Archbishop.
Yeah, Archbishop.
Julian?
Yeah, please.
Yeah. I made a comment at the chat. I think this is wonderful work that Serchi is doing. I wasn't aware the scale, the enormous scale that you have been doing this, and the coordination and your volunteers. You have all the people on the ground. So I think half our work is done. I think in a sense you have been there. Now it's the money, I think, that needs to flow into this whole thing. I think you've got all your people on the ground and everything is there. I think this is where I think I will also share this with MCCBC. We've got some people there, some people here that belong to that organization. But nevertheless, I will do my best to try to fill the coffers so that we will help our fellow Malaysians. Thank you.
Well, thank you so much, Archbishop, for your very kind words and for for chipping in, for coming in to help in this in the emergency fund. So can we have Tuan Haji Muhammad Jamal to say something?
Yeah, thank you, Dr. Victor. I think I'm very, very delighted to be in this discussion today. And actually, we have heard of the great job done by Suchi. In even the ones I heard a few years back was during the typhoon in Philippines, and a few other places, if I'm not wrong, in Nepal and so on. So keep up the good work. Just as Archbishop Julian mentioned, that the focus now is on money, on funds, and it is an emergency fund. I think that is the key point here. And ACCIN is a organization of coalition of 20 NGOs. Some of the biggest NGOs in Malaysia are in ACCIN, and some of these big NGOs have very established humanitarian groups, and I think if we can give them some time, they're on the Zoom today. I think Global Peace of ABIM is here, and also My Care humanitarian group from IKRAM is here. So maybe if they can give some views on how to move forward especially from the Muslim sides, that will be useful. We also would like to welcome Professor Dr. Taufik Yap, the chairman of the Malaysian Chinese Association, Vice Chancellor of the University of Sabah, I think he's here, and then Brother Jason Leong from Christian CPHM is also here. Faisal, Muhammad Faisal, the president of ABIM is here. So I would say if it's important for us to have a name to this particular fund, that is one, and we can probably have a working group putting this forward instantly as soon as possible, so that we can move forward and come up with whatever is necessary to do. So, Dr. Victor, please, thank you very much.
Yes, thank you very much, Che Jamal. Maybe can we have a word from Sheikh Faisal? Do you have something, Sheikh Faisal?
Thank you, Dr. Victor, and Most Reverend Julian, and also Mr. Jamal and our friends. Okay, first of all, thank you for inviting. It is very fruitful discussion, and referring back to our previous generation, ABIM with Friendship Group of Interreligious Services, we used to work with Suci in Fund Day for Handicap. Yeah, it was I think in 2002, ABIM and Friendship Group of Interreligious Services with Suci. And now I have a great opportunity to learn more from Suci, and of course, be from the young generation. ABIM is a youth organization. A lot of things that can be learned from Suci. Great works, especially on professionalism, how to have more confidence from the public, especially the trust from the public to give donation, and of course, what the things that can be offered to the public. Yeah, I do agree with Mr. Jamal. Perhaps we can have more discussion how to have further collaboration, especially in these given trying times of the COVID. Thank you, Mr. Victor.
Okay, thank you so much, Che Faisal. Maybe we will invite Chief Reverend to say something.
Chief, not unmute.
Chief, we can't hear you, Chief. You have to unmute yourself. We cannot hear you. Yeah, yeah. Maybe is Dr. Amir here? No. Dr. Amir, no, not here.
Dr. Amir is around.
Dr. Amir? Dr. Amir, would you like to say something? Amir Farid? No? How about Sheikh Taufik Jab?
Okay, now can you?
Okay.
Chief, yes, we can hear you now.
Can hear? Okay,
Yes.
okay. Because I had to depend on the young people. Anyway, very good evening to the Nato V, and then again our Archbishop Julians and all the brothers and sisters, our brother the Jamal, and all. Almost every one of you all know we used to work together many years, and I would like to highlight this moment. We have been talking, dialogue, whatever, interfaith. But this is the right time for us to be united together. So I'm very happy to be with all of you. And just now, our sisters, the Kaping and other brothers already explained to you all situation. So I have been working with the Suci many years, as well as since the last COVID. Last year COVID started, and I get almost every day the COVID situation from the Suci brothers and sisters, as well as for the government side. Slowly, I try my best to learn and help whatever possible ways. Even during last few months, Ramadan period, also I was helping most of our Muslim brothers and sisters also. And anyway, without further delay, we have heard about all the structures, whatever they have been doing. And time has come for us to come forward and be united. So each and every religious, if not the faith leaders, will be able to take along this good message to our own community, Buddhist community, Christian community, Islam community, to work together as a one family members. So therefore, and I would like to appeal to all the Buddhist organizations without segregating these people, that people, or this sect, that school, and with that religion, this religion, that faith, this faith. So we'll come together and take one message to our Malaysians. And if possible, if we can reach out to the overseas, much better. But unfortunately, this time, all over the world already affected. Even I myself getting many information and asked me to help the overseas countries such as India, Nepal, Sri Lanka, all those, Bangladesh, all these countries also, even Myanmar also. But anyway, so, but first thing is we have to protect our own self. Then can protect others. So therefore, we are not selfish, but time has come for us to look after. So therefore, we must take this good message, clear message to our own community, Buddhist message to the Buddhist community, Muslim community, Christian community, Hindu community, and try our best to convince our people to come forward to help ourselves as well as help others. So, and help our nation and citizen of Malaysia country. So therefore, I strongly advise to all the Buddhist leaders, Buddhist organizations, and please take this message, be united together, and come out with the proper document to convince the people and inform the community, and then we will be able to help and work together with the Buddhist Suichi group, as well as, of course, our Islam brothers, definitely under the leadership of our brother Jamal, as well as our Christian community under the leadership of our Archbishop. So definitely our vision and missions will be able to fulfill as soon as possible. With this, I think that's more than enough. Thank you so much. Hope to work together all the way. So this is today is a foundation for all our Malaysian community. So after this, we must be action, not only dialogue and meeting, action like this. So we will be able to build up. We don't have to talk about politics. We don't have to talk about this and that, but we can work as one family of our Malaysia. So therefore, I hope we come out, all the young people, some proper documents. So we will be able to convince our organizations, all the temples and other associations, societies, committees, to convince to reach out to their followers and supporters. I think that's more than enough. Thank you.
Thank you very much, Chief. Thank you for your advice. And Chief was saying how we should try to reach out to our various religious communities and also to convince them. Yeah, maybe with some promotional material to convince them, and we should be working together as a family. There's also a message for all the religious communities in Malaysia that we do this together as a family. And can I now invite Taojang T. Cho Leong? This is representing the Taoist community.
Good evening, everybody. I'm great to have chances to join tonight's Zoom and understand Sichi had done a wonderful job before this. As a brief, our High Chief saying that we must be all the interfaith as one family, and we're working together to have come up with something in one family to what I call as or raise fund for the currently on this pandemic. That's all. Thank you.
Thank you very much, Tao Jang Thi, for your message. Maybe since this is also the gathering of the Vajrayana Buddhist groups, maybe somebody from the Vajrayana Buddhist Council might want to say something. Brother Pak, yes.
Yes. Thank you. Let me see. Can you hear? Can you see?
Yes, we can hear you very well. Yes.
Okay. Thank you so much again, everybody, for coming here. You know, unfortunately, we have made use of the VBCM platform for this, to bring all the interfaith to come together. So yeah, because time is of the essence. From last weekend presentation from Brother Seo and Sister Kaping is so critical, so urgent. So we thought, we should really put our effort. Yeah, we will put our effort collectively and go all out to get the community together and and really save Malaysia. Thank you very much, everybody.
Yeah, thank you very much, Brother Pak, for helping to arrange all this. It was your idea to have this meeting, and I'm glad you have also managed through the various networking, and also Sister Pai Ling for helping us to get this group together. Maybe I do not know whether Brother Xiaoqi, do you want to say something, Xiaoqi?
No, I think maybe you can invite a few more from the other faith for them to speak. I think that would be better.
Okay.
Particularly a Muslim and a Christian. There's actually a Father Thomas or something. So
Dr. Amir is blocked, Dr. Amir, so he cannot. He's
yes. He's got a family. This thing. He says he's having also some meetings. So Dr. Amir is not able to make it. Maybe
no, he's blocked. His sound is blocked.
Okay.
He's in.
He blocked it, I think.
Can you unmute? Then let them speak, okay?
Himself,
Yes.
So,
and Mr. Jason Leong is okay. He's open.
Mr. Jason Leong.
Yeah.
Yeah.
You want to say something?
Oh, sure. Yeah. Thank you very much, Dr. V.
Yes.
And I'm really glad that we are having this meeting tonight, because it was just about a week ago where I was speaking to a military general about the possibility of some churches and maybe some religious group coming together to fund their field ICU. Because as you have heard from our DG, there was some talk about setting up an additional 1 or 2 field ICU facility. And I was asking for a ballpark figure, and a quick figure that the general gave me was about $2 million US. So I think we are there. So the Suchi figure coming out with, $2 million US is for about 30 bed ICU, so, but doesn't matter whether it's field ICU or what, that one, because we were leaving it to the military. But this is a really timely effort. We are talking about 10 million. It's excellent. So this is that kind of money that we really need to raise the fund for the purchase. I'm glad that Suchi has all the network and the necessary experience to get this done. Actually, at the back of my head, I was thinking that a lot of churches in Malaysia has always been sending out a lot of money overseas to help a lot of people all over the world. So I was saying that it's about time that the churches in Malaysia make a global call for all the mega and rich churches overseas to donate to Malaysia for this time because of the emergency thing. So that was what I'm thinking about. So I'm glad we can do this, and I'm from Christians for Peace and Harmony in Malaysia, CPHM, and also ANCOM, Association of NexGen Christian of Malaysia. So we will definitely want to be supportive of this particular work. And like Jamal say, I think the name of the fund would be if the name is what I think Malaysia Solidarity Fund.
Yeah.
That is fine. I mean, pay to Suji is fine. I think because for emergency and then for the tax exemption purpose, I think that is perfectly okay. You know, Suji can handle that part. But a fund that is symbolic of a national effort coming to Malaysia, that will be easier for us to communicate to whoever is our intended donors.
Yes.
So thank you. Rest assured of our support.
Thank you, Mr. Jason Leong. In fact, it is called Malaysia Solidarity Fund. So in a sense, it is, as a name of the fund, I think it's really quite appropriate. But in order to get tax exemption, the payment would need to be made to SERCI. And then they can, SERCI would be able to do the necessary in order for corporations to get tax exemption. And as we know, I think from what I understand, SERCI, if you donate a certain amount of money to SERCI, 100% of the money is actually used for the target project. Unlike United Nations, you know, when United Nations go anywhere, the administration will eat up about 60-70%, and you know, a small portion will actually go to the target population. But that's not how SERCI does. You know, it's all run by volunteers, and they're really committed. So you know, so we know that the money, there's no leakages as far as the contribution is concerned. This is something to be said about SERCI.
I think do we want to just slot in some term like COVID fund somewhere? COVID.
Okay. So Malaysia Solidarity COVID Fund.
If there's that would be,
so that it becomes really clear what this fund is.
Yes.
Yeah, it's not solidarity for something else. Yes, a good suggestion. Thank you. Yes, all right. Yes. So any other?
Dr. Sri,
yes.
Can you maybe invite Puan Sri Tong Siu Bee? She is actually also here.
Puan Sri,
to say a few words.
Yes, Puan Sri, would you like to say something? In fact, we have.
Hello, good evening. So sorry, so many people don't know how to, address everyone. Just say, all brothers and sisters of Malaysia. Very good evening. Actually, I'm so glad to see that so many people are so, supportive of this solidarity. Now we want to call it Solidarity COVID Funds. CBCM is actually already here in Malaysia almost 30 years. And we have been helping so many people, irregardless of nationality, religion, or race, And in Malaysia, we have now actually 2 million members, about 2 million members, and contributing every month, from maybe 10 ringgit to 10,000 ringgit per month, all walks of life. And also, some people thought that CBCM is very rich. Actually, it's not true. It's all blood and sweat of. The money are actually blood and sweat from the public. Most of our members, they are all ordinary people, housewives or even, workers, blue collars, white collars, all different, all walks of life. Just like just now, Victor said that all 100% of what we receive, the fund we receive, we raise, will be used for the victims. And we are always very particular that we must go direct to the victims, to the care recipients. We don't go through, other middlemen. And I would say it is not just 100%, it's more than 100% because all our salaries, we are not paid, whether transportation, food, lodging, everywhere we go, even overseas, we have to pay for our own air ticket, hotel. Like the last time we went over to Vietnam, to Sri Lanka, when there was tsunami, we have to pay air ticket, hotel, everything we have to pay on our own. So you see, the money that gets to the victims, I think it should be 105%. It's your $1 as is some of our opportunity lost, our working time. So some of us are paid highly, some engineers, some entrepreneurs. So you see, $1 is already make $3. And for this solidarity COVID funds, we are very happy that so many different faiths are also interested to come and participate. And actually today I just went to Sungai Buloh to deliver some ventilators and beds, and I also saw the Dr. Kulip of Sungai Buloh, and actually we are lucky to have her there. She's such a strong-willed woman, and she said, I said the cases are coming down outside, but she said in the hospital, the serious one are still getting more, but I'm very happy and very glad that she is actually very strong-minded, and she really has a very high fighting spirit, and we are very lucky to have her there, and she's really leading her team to work very, very hard, and they were very thankful, And today when I went there, not just Tzu Chi was presenting the equipment, there's also another organization also sending staff to them, So looks like very hopeful, and all the best to everyone. Thank you so much.
Well, thank you so much, Puan Sri Tong, for the update on what is really happening on the ground, even like today. So maybe the meeting has gone on for quite a while. Let me, unless there are some last words, are there any last words before I just do the closing?
Dr. Sri, maybe the taking up from, I think, what Tuan Haji Jamal have actually mentioned earlier, I think we should actually maybe forming an action group, maybe may not be too many people, and then with actually that number from a representative from actually each of the traditions, and then from there, then that they become the channel for us to actually get in touch. And nowadays it's actually very easy. It's actually a formation of a WhatsApp group. And Brother Pick, maybe you can actually identify those people who can actually maybe be in this WhatsApp group and take the steps to actually immediately form this WhatsApp group. Then some are actually the information, then we can actually share through that, and some of whatever have been drafted, you might be able to use them to redraft and to save a little bit of words, and then so that things actually can get rolling quite fast. That is actually my comment, Dr. Sri.
Okay, thank you. Very good comment. And of course, it refers to how do we move forward? Where do we go from here? All right, so that is a very good suggestion from Brother Selki. So I must, in closing, thank all of you for being present here. I think this is a wonderful.
We should take a picture. Sorry.
You take a picture first before the closing. Okay. Sometimes I forget things like that. I need to be reminded. So everybody please turn on your camera so that we can see who is who. So who will be taking the picture, Brother Pak? Are you good with the camera?
Brother Fu. Brother Fu will take the picture.
Brother Fu.
Brother Fu will take
everybody,
the picture.
My suggestion is everybody take a picture because it's different perspective from different cameras,
That's true.
So
That's true.
everybody please take a picture. And then
someone like to speak.
Somebody else wants to speak.
Yeah,
Then yes, okay. We take a picture first, okay?
Okay.
Please, Brother Fu will take the picture for all. Don't worry. You just on your.
Okay. All right. Okay.
Everyone
Victor, I would like to request two persons to speak. One is Natalia Tan, who is that our well-known writer.
Yes.
Tan, and another one, a gentleman, is Dato' Lee. Dato' Lee from Ipoh. Can you say a few words as well, Dato' Lee?
Okay. Have we taken the pictures? We cleared the picture.
Yeah, I've taken already. You all can go ahead.
So can we have Natalia, please?
Hi, thanks so very much. Nice to see everyone. A lot of old friends here. I'll try to be as fast as possible. My name is Nathaniel Tan. I work with the Projek Wawasan Rakyat. And this year, POWR, this year we are working very closely with ABIM to launch Projek Bangsa Malaysia, which is what we call a post-political nation building project. We're going to focus on three things. The old culture of VIP is very important people. We want to replace with values, impact, and policies. Values is about the meaning of Bangsa Malaysia coming together to decide what Bangsa Malaysia means. Policies is about creating a policy bank of good non-partisan policies. But the impact part of our project is actually exactly what you guys are doing here. It's a lot about bringing together all the different people who are doing good work on the ground and see how we can come together to become greater than the sum of our parts. Social capital. So if it's okay to add me into the WhatsApp group, one of the few things that we are good at doing is we are good at managing WhatsApp groups and networking and building social capital. So we'd love to build relationships with all the people here who have been doing great work. Also to help to be a better narrative when it comes to like racial conflict and things like that, so that we have a network that we can use to be a better voice and create a better narrative. So I'll leave my number again in the chat. We're happy to talk to anyone about Projek Bangsa Malaysia. And if any of your initiatives, any of these joint initiatives, you want to use a Bangsa Malaysia brand, please feel free, so that we all can, it helps create a sense that we're all helping the country together as one. So thanks very much. I'd love to hear from anyone.
Yes, thank you, Nathaniel. We certainly would like to have you in the group. Yes, in the working group. Can we have Dato' Lee from Ipoh, please?
Oh, hi. I'm Lee Hao Hian from Ipoh TNG Buddhist group. Yeah, I think on this initiative, it makes sense to use the party that's most ready and most integrated and have the infrastructure, and that is Suzira. And if we make it a consolidated, combined effort, then I think it will be very meaningful for both nation building and relationship building. Thank you.
Thank you so much. So I guess. Let me just close today's meeting by saying that I feel very happy that we have representatives from various religious groups coming together, and this is wonderful because coming together to do something for fellow Malaysians is a wonderful thing. And as Dato' Lee did mention, that the infrastructure is there. We are really talking about Searchy, who has actually been doing this work. Even before we meet today, they have been doing it before this, and they already got the infrastructure, they got the connection. So why don't we just make use of this kind of infrastructure that's available? So we'd like to actually thank, the representatives from, we have the Archbishop here, Archbishop Julian, and we have Tuan Haji Muhammad Jamal and Muhammad Faisal. We also have Tau Jang Di, and as well as the leaders from the Vajrayana Buddhist group. Clearly, we could see that the hospitals and clinics do need help, and being NGOs and being involved in spiritual matters, being religious groups. It is something that we should actually try to do, an extension of our value system, of something that we actually do. This is life-saving situation for patients who are in critical position, and we're talking about raising 10 million by June. And of course, in order to do that, you need to have what is the plan, how to get it done. Obviously, you can just have a notice and just circulate it in a kind of WhatsApp group, but is that the best way of doing it in order to drive this? So like what Brother Xiaoqi mentioned, let us form a group, some kind of action group, so that then where different communities are represented, so we can actually try to get together, and in order to see that, can we craft messages that can actually go down, so that there can be some kind of action coming in, and it has to be done fairly fast. And like our chief was mentioning, that the chief feels happy that various religious community are here working together, and this is really a common message for Malaysians. And so we should take back this message to our own religious groups in order to try to persuade them to do something from fellow Malaysians. Muhammad Jamal did mention about working out the details. Especially amongst the Muslim community. Archbishop Julian is very supportive of this project, and we took the message down to his EXCO members to see how they can try to get more people involved in this, something really good that we can do together. And also Mr. Jason Leong was saying that maybe you can even get the churches overseas if they would like to make contributions to Malaysian this time, because Malaysia has always been the contributor, and now we are in the a situation of need, whether or not they might be able, whether they would like to do some kind of contributions to Malaysia. And so thank you very much also for the Turkey team, Brother Sio and Sister Kapeng, for your presentations. And let us really have a prayer and hope that may the amount that we're talking about be successful. May we be able to get the amount, the amount that we're targeting for, in order to help out situation, the hospital and clinic that badly need them. And may the COVID-19 situation be quickly abate and disappear, so that lives can actually return back to normal again. We do not want to lose loved ones through COVID-19. Yes. So with that, I would like to wish all of you.
Thank you.
Good night. Thank you so much for coming. Thank you.
Thank you, everyone.
Thank you, everybody.
Yeah.
Thank you.
Good night. Thank you.